Good afternoon, everyone. Thank you so much for joining today's Lead Center webinar, part of our Promoting Employment series, Best Practices in Employee Retention and Return to Work, Lessons Learned from Employers. My name is Elizabeth Jennings. I'm the Lead Center Assistant Project Director here at National Disability Institute, and I'll be today's facilitator. I'm also very happy to have joining us today Ken Matos, a Senior Director of Research with the Families and Work Institute, and Rebecca Salon, Lead Center Project Director with National Disability Institute's Lead Center. For those of you who haven't joined us before, the National Center on Leadership for the Employment and Economic Advancement of People with Disabilities, commonly called the Lead Center, is a collaborative of disability, workforce, and economic empowerment organizations led by National Disability Institute with funding from the U.S. Department of Labor's Office of Disability Employment Policy. Before we get started with today's webinar, I'm very pleased to offer a welcome from Christopher Button. Thanks for joining us today, Chris.
Thank you, Elizabeth, and our lead colleagues there, and certainly to our speaker today, Ken. I have to say that one of the exciting honors, really, that we have when we work here at the national office in a federal office like ODEP is that we get to work with national leaders in really important areas. And it's probably the best part of my job personally, and that's certainly what we're doing today because we have a really important area, employee retention and return to work, hearing about, you know, what can employers do to keep or bring back skilled employees that they really value, how can we learn or take what we have learned from the world of disability and how does that apply more kind of universally to the generic workforce, and that's one of the things we're going to be talking about today. And the other honor that we have is working with national leaders, and the Family Work Institute in this particular area is, I think, an acknowledged leader. So I think we are all in for a real treat. Ken is our primary speaker. Ken Matos is just a pleasure to work with. We have had the good fortune of partnering with the Family Work Institute through our LEAD Center as they implemented the national survey that Ken's going to be talking about, and also another one that they're going to be doing through LEAD or with LEAD as a partner coming up this coming year. So thank you, Elizabeth. Thank you, Rebecca. Thank you, Ken. And I'm really looking forward to today's webinar. Welcome to everyone, and thank you for being here today.
Thank you so much. Very much appreciated. I'm now going to ask my colleague, Nakia Matthews, to provide you with some housekeeping tips.
The audio for today's webinar is being broadcast through your computer. Please make sure that your speakers are turned on or your headphones are plugged in. You can control the audio broadcast via the audio broadcast panel, which you see below. And if you accidentally close this panel, or if the sound stops or becomes unintelligible, you can reopen the audio broadcast panel by going to the top menu, Communicate, Join Audio Broadcast. If you do not have sound capabilities on your computer or you prefer to listen by phone, you can dial the numbers that you see here, and I will post these numbers into the chat box. Real-time captioning is provided during this webinar. The captions can be found in the Media Viewer panel, which appears in the lower right-hand corner of the webinar platform. If you'd like to make the Media Viewer panel larger to see the captions, you can do so by minimizing some of the other panels like chat or Q&A, and conversely, if you do not need the captions, you can minimize the Media Viewer panel. There will be a question and answer portion at the end of the webinar. Please direct any questions that you may have to me or to Rebecca Salon during the course of the webinar, and we will direct them accordingly. If you are not logged into the web portion and you'd still like to ask a question, you may do so by emailing Elizabeth Jennings directly at ejennings@ndi-inc.org. Please note that this webinar is being recorded and that the materials will be placed on the Lead Center website at the URL you see below. If you experience any technical difficulties during the webinar, please use the chat box to send a message to me, Nakia Matthews, or you may email me directly at nmatthews@ndi-inc.org.
Thank you, Nakia. The LEAD Center mission is to advance sustainable individual and systems-level change that results in improved, competitive, integrated employment and economic self-sufficiency outcomes for individuals across the spectrum of disability. We strive to do that by doing things like today's webinar. And during today's webinar, we're going to, of course, discuss with you some of the webinar outcomes, introduce you to the Families and Work Institute and its 2014 National Study of Employers, provide you with findings from the 2014 National Study. We're going to review the LEAD Center study on retention and return to work policies and practices that we gleaned from a large, successful U.S. corporation. We're going to look at some lessons learned in employee retention and return to work best practices. We're also going to discuss partnering with employers to promote employee retention and return to work and strategies for identifying employers with policies. And I'm so sorry, everyone, that one piece is a typo. My apologies. We're going to make sure that we have some time for question and answer. So please, as we go through today's agenda, I hope that you will place some questions in the Q&A box, and we'll hold them until the end. At the end of the webinar, we hope that you are more familiar with the Families and Work Institute, When Work Works, and the National Employer Study. You will have a better understanding of the state of workplace flexibility, employer retention and return to work best practices. You will also learn how workforce professionals can partner with employers to promote employee retention and return to work. And finally, you will learn how to identify employers' policies that support workplace flexibility. And my apologies again. And you will also learn how to identify employers' policies that support workplace flexibility, including customized employment. You'll all have to forgive me. I'm very excited to hear from Ken today, and I'm just not containing my enthusiasm very well. So let me jump right to Ken and introduce him. Ken Matos is Senior Director of Research at Families and Work Institute. He conducts research on many workforce and workplace issues, including diversity, mentoring, work-life fit, and workplace effectiveness, using findings from the FWI's ongoing nationally representative studies, the National Study of Employers, and the National Study of the Changing Workforce. He co-directs the When Work Works project, as well as the Veterans Employment Transition Award Program, which recognizes companies that are doing innovative, effective programs for veterans and their families. Prior to joining FWI, Dr. Matos worked for the Department of Defense, where he developed, implemented, and analyzed surveys of members of the U.S. military, their families, and related constituencies. He has appeared on the Today Show and National Public Radio, I'm not sure which is more exciting, and is regularly quoted in the major media. Dr. Matos, thank you so much for joining us today. I'm going to hand this off to you.
Thank you so much for having me. I appreciate the really warm introduction. As Rebecca said, I am the Senior Director of Research at the Families and Work Institute, and we specialize in two surveys, the National Study of Employers and the National Study of the Changing Workforce, which looks at employees. And today I will be talking to you about some of the results from our 2014 National Study of Employers, primarily around issues of workplace flexibility, and then give you a little bit of a teaser of the kinds of questions we're going to be looking at in our study of employees that relate to specifically people with disabilities issues and how we connect that into our larger research agenda. So a lot of this research is funded through our When Work Works program. It's a nationwide initiative to bring research on workplace effectiveness and flexibility to community and business leaders and to encourage them to make positive change in their organizations, to make more room for people to find ways to integrate their personal and professional lives and become more successful in both. as well as helping their employers reap the benefits of people who can be more holistic and attend to all the different parts of their lives well. Since its inception in 2005, we've shared rigorous research. We've recognized exemplary employers through our When Work Works Award, which looks at their policies as well as gets feedback from employees in order to determine some of the leading companies on these issues in the U.S. today. And just inspire change so people build more effective and flexible workplaces. The Families and Work Institute is a nonprofit, nonpartisan research center. We specialize in looking at ways in which different parts of people's lives can interact together to create more positive outcomes for them and those they care about. And our other partner in the When Work Works project is the Society for Human Resource Management, which is the world's largest HR membership organization and represents more than 275,000 members in over 160 countries. And they are also very interested with us in helping organizations use their human resources more effectively. So our 2014 National Study of Employers is a study we conduct of employers with 50 or more employees. We use that benchmark because many laws or reporting requirements activate at 50 or more employees, and so we use that as our minimum size. However, we go much larger, and so the data I'll be presenting is representative of employers across the country with 50 or more employees. The study was conducted between September 13th, 2013 and January 31st, 2014. We looked at over 1,000 employers and weighted the data to be a representative of employers of all sizes and had a response rate of about 40%, which for surveys such as this is quite high. The study is considered one of the most comprehensive and far-reaching studies of the practices and policies of employers in the U.S. and how they are meeting the changing needs of the workforce. We've conducted it several times, 1998, 2005, 08, 12, 14, and we expect to conduct it again for release in 2016. It serves as the benchmark for our award project. In order to be a winner, you first have to be in the top 20% of employers that are giving workplace flexibility and effective workplace policies. And this slide is just slightly outdated. It turns out that we have announced our new winners today. So if you want to see some of the top employers for flexible and effective workplaces, you can go to our website at whenworkworks.org and look up our new winners today. So now I'm going to present some of our findings from the study, which is going to compare data from 2008 and 2014. So one of the major points of the survey is workplace flexibility, and we break workplace flexibility up into 17 different components. It's much more complex than just being able to work remotely or being able to adjust your start and stop times. It includes issues around managing shifts, managing overtime, being able to take leaves, and so we examine each of these different components of flexibility separately. Well, a major theme that we found in looking at the data was that employers were more likely to offer flexibility options that allow employees to better manage the times and places that they work, primarily on sort of day-to-day bases. So being able to take time off during the workday to attend to important family or personal needs is more common. Having control over unpaid or paid overtime hours, or being able to take breaks when you need to is more common in multiple companies. And so we see more ability to reallocate when you're doing work within a day or week sort of time frame. It also applies to where you're doing work, as we've seen more organizations are allowing employees to work their regular paid hours at home. However, when we look at flexibility that is associated with lengthier time away from full-time work, we see fewer employers indicating that they offer these options. between 2008 and 2014, we see fewer employers offering the opportunity to take a career break for personal or family responsibilities, to take a sabbatical, to work part year, or to share jobs. In employees with disabilities context, this likely means that disabilities which require adjustments on when and where you work are probably going to be easier to find employers that are already making strides in creating that kind of flexibility, but being able to find time for lengthier breaks in work, such as for a therapy or a treatment, may be harder to find. And so thinking about how workplace flexibility works in this arena, that's something that activists and policymakers around workplace flexibility may want to consider in terms of making sure that employers are fully inclusive of people with disabilities. We also look at caregiving leave, and in 2014 we were able to identify FMLA, or Family Medical Leave Act, covered employers. And so looking just at those who were covered by the Family and Medical Leave Act, we found that the vast majority are offering 12 weeks or more, which is what's required by the Act. Though of those employers that are offering more than 12 weeks, they generally seem to only offer the one additional week. So somewhere between 66 and 73% will offer 12 weeks for all four types of leave, but the remaining about a third tend to offer only an extra week. In addition, when we look at those who are offering fewer than 12 weeks, we see about 9% are offering less than 12 weeks to take time to care for a seriously ill family member, which, as you see, is only a little bit higher than maternity leave noncompliance, which is at about 6%, which is our lowest indicator. The place where we see the least compliance is around paternity leave or leaves for spouses, partners of parents. Overall, we find that 21% of employers who indicate that at least one of their work sites was covered by FMLA reported that less than 12 weeks was offered for at least one of these four forms of leave. So we see about 21% of employers are not complying with FMLA in at least one of these four ways. And this is fairly consistent with our data in previous years. And as you can see, our data from the past, this chart looks at the percentage of employers that are not offering 12 weeks. So this is showing the relative decline in noncompliance. And as you can see, most of the noncompliance seems to be primarily around spouse and partner or paternity leave, with medical healthcare leave matching the decline in noncompliance for maternity leave and adoption leave. So we see some good news in terms of improved employer compliance over the years since we started collecting the information. When we look at the average amount of time given for caregiving leave, we see that maternity leave has remained statistically the same between 2008 and 2014, but we've seen declines in the maximum amount of time offered for the other three options. Specifically for employees to care for seriously ill family members, this has gone down from 13.3 weeks as an average maximum to 12.1. We also ask about employers offering replacement pay during caregiving leave. And we've seen that employers are just as likely to provide any replacement pay in 2014 as they were in 2008 for female employees who give birth. However, they are less likely to provide full pay, and they are more likely to say it depends on the situation, suggesting that they have different policies for different people. One of the things that has come to my attention recently is the dictate for many women who go off on maternity leave, especially the disability portion of their leave, not to communicate with the office in any way or to have the office communicate with them. There's a lot of conversation now about how that mandate that many HR departments provide works against women's return to the workforce. It ends up creating lengthy periods of time where their identity focuses solely on parenting and less on their work identity. And in talking to some experts in the field as to why and where this mandate came about, I was surprised at how many sort of HR people were not aware of the source and ended up going to an employment lawyer who described that impetus for those directives comes from the way the insurance policies are written, as they generally require that an employee be incapable of doing any work in order to receive short-term disability insurance payments. And so that is an interesting reality from a retention perspective of people who might be making use of short-term disability, because it sets up people who might be able to do some work but just need to maybe reduce their workload for a period of time while they recover, to look at their work involvement as a binary. They're either there or they're not, and may effectively weaken the strength of their likelihood to return, their connection to their employer, their understanding of what's going on in their workplace while they're out on leave. And so some organizations may consider looking at their short-term disability insurance policy to see if there's some way to arrange it for employees to be able to use it to cover reductions in employment, as opposed to sort of forcing them to leave entirely or be in the workplace entirely. Another area we look at is elder care assistance. In 2014, we found that larger employers were more likely to provide elder care resource and referral than smaller employers. And since 2008, employers are more likely to provide both elder care resource and referral DCAPs, which stands for Dependent Care Assistance Programs, and access to respite care. What's interesting about this is that organizations seem to be investing more effort in things that either allow them to sort of channel information to employees to make better decisions, or which allow employees to better utilize their own money through economy of scale programs like DCAPs, which allow you to use your pre-tax money in order to support your dependents. And so when thinking about how to encourage employers to be more engaged with assistance programs, it may be important to start with the sorts of programs that allow them to help employees make better choices or use their resources in more effective ways than starting with having an employer engage with a potentially costly program on their own to start. We've also seen an increase in the percentage of employers providing employee assistance programs and wellness programs, from 58% in 2008 to 77% for EAPs, and 51 to 60 for employers providing wellness programs. And so these are opportunities for employees to get support through their employer around any issues that may be making it difficult for them to take care of their health or succeed on the job. That is more than just, do I need training or do I have the supervisor task support, but really being able to talk about some of the emotional, social, and personal life dynamics that may be interfering with their ability to be as successful in their jobs and in their lives as they would like. We also asked the employers to tell us a little bit about their culture of flexibility and supportiveness. And this really drives at the degree to which the organization not just has policies on its books, but is telling its management, the people who administer and implement these policies, to really live them in meaningful ways. And what we find is a little bit unfortunate. We see no real change in whether or not employers say that they encourage their supervisors to be supportive of employees with family needs, or to make real and ongoing efforts to inform employees about available assistance programs. But we do see some significant reductions in the percentage of employers that are saying they encourage their managers to assess employee performance by what they accomplish and not by how many hours they spend in the workplace. So disregarding face time and focusing on results seems to be less common. As well, we see fewer employers saying that they reward managers who support effective and flexible work arrangements. And so while they're still saying the same things, they seem to be putting a little bit less of their infrastructure and their resources towards promoting actual positive behavior in their managers. When we look at healthcare benefits, we see that more employers are providing some healthcare benefits than in the past. So health insurance coverage for full-time employees, more paying the full premium than in the past. We also, as I said earlier, we see more wellness programs. We also see more private spaces for breastfeeding women. And that's been a quite large jump since the passage of the Affordable Care Act, which happened between 2008 and 2014. When we look at large and small employers and who's likely to offer personal health insurance coverage, we see that it's about the same, 99 versus 100%. But small employers are more likely than large employers to pay all of the premiums. And while we're not 100% certain why this is the case, our best guess is that small employers have more personal relationships with the individuals for whom they're providing this health care. It's easier for them to understand what it means. It's also a bit of a numbers game. When you have a very large workforce, you're probably more likely to be incurring access and use of those healthcare benefits as opposed to a smaller workforce where the probability that somebody in the that you employ or in their family is going to need an expensive treatment is less likely. And so the cost analysis probably just turns out to be a bit different between small and large employers. More large employers are asking employees to pay a larger share of their healthcare premiums than smaller employers, and that goes back to the reasons that I was explaining earlier for offering full payment in the first place. We also look at some aspects of policies that employers offer to help keep their employees in a state of economic security. And we've seen both increases and decreases in these zones. So more employers are offering TDI and 401ks, but we haven't seen any real change in offering of pension plans, contributions to retirement plans, or financial assistance for education and training. We've seen some decline in providing assistance in obtaining public benefits. Some previous research that Families and Work Institute has done has looked at the idea of making employers a sort of central hub for getting public benefits to employees. And in that research, we found that while it made logistic sense, the marketing was also very important in order to make it successful. If employees were told that they were being given a benefit or something that they needed because they were in some way deficient, even if it would actually put them in a better place, they were much less likely to engage with the benefits fairs or other supports that they were being offered through the public assistance. When it was talked about more as something that they had earned as providing taxes, and this is part of being a citizen and was a norm as opposed to a help, they were more likely to engage with the activities. So when thinking about that last piece of how we can bring public benefits through employers, it's important to really think about how you talk about what you're offering and why you're doing it. So that's a quick summary of a lot of the research that we've done looking at employers and hearing what they have to say. As I mentioned earlier, we also do a national study of the changing workforce, which is a nationally representative study of employed persons 18 and older in the U.S. And we ask them a really wide range of questions about their attitudes and experiences both on and off the job. And with that information, we've discovered things such as men are experiencing more work-life conflicts than women at this point in time, as the identity and role of men has been changing in terms of their place in family and work. We've also seen changes in attitudes around work and family with different generations, and been able to develop an effective workplace model composed of 6 experiences that employees need to have in order to show greater intent to stay, job satisfaction, and engagement with their work. As we look forward to our 2015 edition of the national study, we've partnered with LEAD and the Office of Disability Employment Policy to develop items to look at the experiences of employees with disabilities and compare that to employees without disabilities throughout our survey. So all employees are going to be asked all questions about things like job satisfaction, supervisor support, and we also have developed some unique items to help us really address the employees with disabilities topics. So we are including an 8-question objective measure of disability status, which is going to be comparable to the American Community Survey. So we'll be asking people whether or not they have difficulty doing particular tasks or functions in their lives or their work. And then following up that objective measure with a subjective measure, asking if they identify as a person with a disability. And we'll hopefully be able to see whether or not there's differences in people's experiences based on the disabilities that they have and the identity that they profess. As some researchers are suggesting that there may be a distinction between people who have challenges that qualify as disabilities but don't see themselves as a person with a disability, and people who actually identify with that statement of being a person with a disability. So that's one of the research areas we're going to be exploring. We're also going to be asking some questions about how supportive people think their workplace is for employees with disabilities, and we'll be able to compare the responses of people with disabilities versus people without disabilities based on those measures that I just discussed. And we'll also be asking people with disabilities what on-the-job supports are needed for them to be successful on the job. So we'll be having a very robust and diverse collection of information that will be comparable across multiple populations. And so we're really looking forward to the work that we're going to do with LEAD and ODEP support. So at this point, that concludes my portion of the presentation. And so I look forward to any questions you have during the Q&A section.
Thank you so much, Ken. We really appreciate your participation, and I'm really fascinated by some of the things you shared with us, and looking forward to the Q&A portion so that we can potentially delve deeper into a few of the findings. So I'd now like to introduce all of you on the line to our LEAD Center Project Director, Dr. Rebecca Ceylon, who will be talking about best practices in employee retention and return to work, lessons learned from employers. Welcome, Rebecca. Thank you for joining us.
Thanks so much, Elizabeth, and thank you, Ken. That was a great presentation, and the LEAD Center, so appreciates the opportunity to partner with the Families and Work Institute, and are looking forward to the national study of the changing workforce and the information that it'll provide the field about the experiences of people with disabilities in the workforce. We think it's going to be a wonderful contribution, so we look forward to that. We will, as Elizabeth said in the beginning, have time at the end for questions. So if you have questions for Ken that you don't want to lose, type them into the chat box now, and we'll get to them at the end. So my portion of the presentation is going to look at best practices in employee retention and return to work, in part doing an overview of the LEAD Center's work and ODEP's work on retention and return to work, with a focus on an in-depth study that we did with a single employer that was doing very innovative work in that area. We also collaborated with the United States Business Leadership Network on a survey of their members that will provide you with some results, and also want to discuss customized employment as a universal design and as another promising practice in terms of workforce flexibility, as well as a strategy for keeping people in the workforce who may experience illness or disability or injury. So what are retention and return to work strategies? Basically, there are strategies that enable people to resume work in some capacity as quickly as possible. What it provides is a reduction in workers' compensation costs for employers. It enables people to maintain their productivity. It provides strategies that maintain a connection between the employee, their supervisor, and the workplace, and reduces turnover and retains talent in the workforce. And as we all know, turnover is one of the most costly items for employers, both in terms of the loss of talent and the loss of productivity. So it's very important that we understand about retention and return to work. The study that we did with the U.S. Business Leadership Network focused on retention and workplace flexibility. The USBLN is a national nonprofit organization founded in 2002 that helps businesses drive performance by leveraging disability inclusion in the workplace, supply chain, and marketplace. And you all may have affiliates of the Business Leadership Network in your state or in your community who are doing similar work. We worked with the national organization and collaboratively did a study that was sent to 60 corporations who were their members. 24 responded, so we had a 40% response rate. And they represented a range of company sizes and a variety of industries. Most identified that 20% or more of their workforce were mature workers. So there was some focus on the aging workforce and mature workers, as well as workers with disabilities. Overall, workplace flexibility as a retention strategy was valued and integrated into company culture for all the respondents. So one of their findings was that workforce flexibility, as Ken highlighted, was very important in terms of retention and return to work. Additionally, 2/3 of the respondents reported that they actively took actions or created policies and practices to become more age-friendly and or to provide workplace flexibility in the areas of recruitment, workplace accommodations, and training, with workplace accommodations receiving the most yes responses. So workplace accommodations was the most common form of workplace flexibility that they found in the survey. The flexible work arrangements, when they were asked about specifics, included job sharing, telework, flex time, job carving, and negotiated job descriptions. You may not be surprised to hear that flex time and telework were the most common responses, with 100% and 91.7% respectively saying that they offered either flex time or telework. Negotiated job descriptions was the least common response at 8.3%. And we'll talk about negotiated job descriptions shortly, since it's a valuable strategy and has a clear link to customized employment as a universal strategy. Most also reported that they had staff who were trained in accommodations. So again, from this sample, the workplaces had resources who were trained in accommodations. So approaches to workforce flexibility are key in enabling employees to stay at work and return to work, and for long-term retention. So what do return to work programs look like? Return to work programs are retention strategies to retain valued employees and to enhance the productivity of the workforce. Return to work programs are designed to return a worker who's injured, disabled, or temporarily impaired to the workplace as soon as is medically feasible. This often involves a progressive return to full duty. That return to work programs are typically part of an overall disability management strategy within employers, and they can be managed in-house or through third-party vendors. Return to work programs may also include temporary or permanent accommodations. So accommodations might include things like a modified schedule, modified job duties, modified methods for completing job duties, transitional work, reassignment to an alternative position. We provided on this slide, which you'll be able to follow, a link to a wonderful resource put out by the Job Accommodation Network, also known as JAN. It's a resource on return to work programs that are part of their accommodation and compliance series, and offer many more resources that can give you more information about return to work programs. So return to work strategies are one of the best practices in workplace flexibility. And workplace flexibility, as Ken mentioned, is something that Families and Work Institute has studied for a while. It's a basic business strategy with proven positive impact on turnover and employee productivity. Flexible work arrangements enable employers to both attract and retain workers. And there are three pillars to workplace flexibility: flexibility of time, place, and task. And here again, we provide you with a resource that's available on the Office of Disability Employment Policy's website on workplace flexibility that includes a 3-page paper on workplace flexibility as a strategic business approach to an inclusive workplace, and also provides links to a toolkit with information for employees, employers, policymakers, and researchers. Within this toolkit, there also are sections on the 3 pillars of workplace flexibility with links to dozens of resources each, including fact sheets, case studies, and more. So when we talk about time, place, and task, what might that look like as a return to work strategy? Time flexibility could be rescheduling hours worked, altering shift and break schedules, or compressing the number of hours worked each week. Place could be enabling an employee to telecommute from home or some alternative location for all or part of their time. Task flexibility could be changing what job tasks an employee performs, having employees share the responsibilities of a full-time job, or reassigning some tasks from one position to another to promote greater productivity. We wanted to spend a little time talking about customized employment as a retention and return to work strategy. As I noted previously, very few employers in the USBLN survey reported using negotiated job descriptions as one of their strategies for flexible workplace or for worker retention. Customized employment is a universal strategy designed to personalize the employment relationship between an employer and an employee to meet the needs of both. Customized employment creates an individualized match between the strengths, conditions, and interests of a job candidate or employee and the identified business needs of an employer. And I again would offer that on the ODEP website, as well as on the Lead Center website, there are robust resources on customized employment strategies, case studies, and information, archived webinars to learn more about it. We'll give you a little information here about customized employment and workplace flexibility. A customized job description is created based on task reassignment, job carving, or job sharing, typically. Task reassignment might be where some of the job tasks of an incumbent worker are reassigned to a new employee. Task reassignment typically takes the form of job creation, whereby a new job description is negotiated based on a current unmet workplace need. So again, it meets the needs of the employee as well as the employer. Job carving takes an existing job description and modifies it, containing one or more, but not all of the tasks from the original job description. And job sharing is where two or more people share the tasks and responsibilities of a job based on each other's strengths. This is a universal design, something that definitely opens doors for people with disabilities, but is something that benefits everyone in the workplace as well as employers. For any of us who have been in a position for a long amount of time, chances are we have a customized job, whether or not our job description has changed, that jobs tend to be modified based on our strengths and our employer's needs. So this brings us to the in-depth look that we took at an American corporation that was doing some things that we thought were noteworthy and could benefit the field. So we're going to provide you with some information about this corporation and some of the practices that we believe should be replicated because they support retention and return to work and make workplaces much more accommodating to older workers, to workers with disabilities, or to anyone who's experiencing a challenge. The corporation in this study chose to not be identified by name, so we will not be using their name as part of this presentation. There will be a report about this study posted on the Lead Center website shortly. So the Lead Center studied best practices in a large, successful U.S. corporation to learn about and document their effective retention and return to work policies and practices. We sought to describe the practices and strategies at the individual level, at the workplace level, and the systems level that benefited both the employer and employees. So we focused on workplace culture, the workforce itself, benefits, and the programs that they developed to support retention and return to work. This corporation was chosen to provide us with insight into employer challenges and the solutions currently in place to address them. They are a large multi-site corporation. We specifically chose a large multi-site corporation to ensure that the workforce would be diverse and would represent urban, rural, and suburban settings. They had a mix of full and part-time employees. And for any corporation, their ability to attract, train, and retain highly qualified employees is critical to its business and financial condition and the success of its operation. This corporation clearly realized that its success depended to a significant degree on the continued contribution of all of its employees, including members of its senior management, key operations, merchandising and administrative personnel, and others, and that the loss of those employees could have an adverse effect on the corporation. As is true in most businesses, they must attract, train, and retain a large and growing number of highly qualified employees while controlling related labor costs and maintaining their core values. This corporation invested significant resources in training and motivating employees. It experienced low turnover and high employee retention, with turnover at 6% after the first year of employment, and an average tenure of 10 years of employment in a retail industry that typically has high turnover. So this corporation really demonstrated its success at retention and return to work. So we want to talk some about the structures that they created that made that possible. One was how it communicates its corporate culture. So that was a real strength, and we'll go into some more detail about each of these 5 structures that we'll be discussing. The second is the value it places on its workforce, treating its employees like valued customers. The third is engaging service providers and vendors, who they then require to support the workforce in an integrated, collaborative manner. The next structure is that they ensure that key people maintain communication with employees who experience disability, injury, or illness, so that they receive needed support in a timely manner and know the extent to which they are valued. And finally, they train and support supervisors and managers so that employees hear consistent positive messages and receive timely support, especially if they're not able to be at work for a period of time and or cannot do all the essential functions of their job. And as Ken discussed in the previous presentation, it's important to look closely at the culture of flexibility and supportiveness within an organization when you're looking at the organization's ability to support a workforce and to sustain people, lower turnover. So first we'll look at its corporate culture. The corporate culture in this corporation truly treated employees as customers. They acknowledged employees as important company assets, and they focused on providing the right benefits under the right plan at the right time. This philosophy led to the creation of an integrated leave department that integrates retention and return to work services through a network of vendors. They demonstrated a commitment to providing a living wage, good benefits, career opportunities, and seamless income protection if illness and injury precludes working. And again, Ken mentioned income protection as one of the things that they studied as well. This company took that very seriously, and as we'll discuss in a minute. So what are some of their promising practices that promoted retention and return to work? They offered an array of programs and services that promote prevention and the management of disability and or that support health and well-being. So there's a fairly robust array of programs and services. They offer liberal paid and unpaid leave of absences to accommodate work-life balance, and they have vendors and managers trained to collaborate on stay at work, return to work, transitional return to work, and prevention programs. Their disability management program creates linkages to ensure that services are integrated, personalized, and that vendors collaborate. So their vendors are disability-related programs. It could be workers' compensation, short and long-term disability, employee assistance programs, disease management programs, wellness, healthcare, and rehabilitation programs, and other medical and clinical support services. So not only do they provide them, but they ensure that they're integrated and personalized. Vendors are trained on the corporation's culture and the corporation's capacity for workplace flexibility. And these are, again, third-party external vendors. Service integration has increased their efficiency and effectiveness, which has reduced the disruptive impact of injury and illness. Business agreements are required between the vendors. So the corporation has ensured that there are business agreements in place between the employee assistance program, workers' compensation carrier, health care plan, short and long-term disability carrier, disability management service providers, and wellness service providers. Having these agreements remove barriers to communication particularly in response to HIPAA requirements. These agreements have significantly improved collaboration and communication between vendors. Further, they require that all vendors attend an annual 2-day summit to share information on their services. Each year, all vendors are invited to the headquarters for this 2-day summit, in which presentations are made about their services, how to access them, and the processes that they use. Vendors familiarize themselves with the services available through other suppliers. At first, the vendors viewed each other as competitors and were kind of uncomfortable with the concept of a summit, since they, in some cases, offered competing services. However, the corporation has held these summits for 5 years now, and each time resistance has lessened and collaboration has increased. Collaborative efforts between the EAP, workers' compensation programs, short and long-term disability programs, health care plans, suppliers of prevention and health and wellness, and case management providers make each provider aware of each other's resources and referrals available when an employee needs assistance. This enables vendors to do outreach, send referrals between each other, or alert another provider about an employee's possible need for services. The corporation also ensures that vendors are trained to actively listen and create linkages when needs surface, and all participate in monthly grand rounds and make case review calls to discuss individual situations. So there are built-in monthly ways that ensure that they communicate and collaborate so that the return to work planning is very personalized and timely. So the components of their integrated return to work program includes an employee assistance program. Their short-term disability vendor serves as their return to work coordinator, designing, implementing, and individualizing return to work plans focused on an early and safe return to work. And those are done collaboratively with the employee and their supervisor. After 6 months, if someone still is not back at work, the long-term disability component begins, and that could include medical and vocational rehabilitation for someone who has a longer-term disability. They also then institute transitional return to work and prevention programs. But the clear message to employees within this corporation's culture is that they're valued and the corporation wants them to return to work. So the services and activities that support transitional employment for return to work are that managers are given checklists so that they have a better sense of the options that might be available for someone to transition back into the workforce. Job duties may be carved out and or customized to meet the employee's capacity and the needs of the business. Decisions that are made become part of a transitional employment return to work plan, and the offer of a temporary modified job opportunity may be made at that point. And as we noted in the beginning of the presentation, sometimes the return to work program involves a progressive return to full duty. So as someone is engaged in a transitional return to work plan, the process may repeat itself as restrictions may be reduced or eliminated as someone is able to be at work more or do more pieces of a job. Some of the sites of this corporation provide on-site rehabilitation, which could include physical or occupational therapy provided on-site so that people don't have to leave the workforce or so that they could be supported in returning to their job. It could involve coaching, work conditioning guidance, education on proper posture when working, and general education to prevent injury or re-injury. So there's a broad array of services that are available. Additional promising practices is that they hold job assessment meetings. So reasonable accommodations are explored through these job assessment meetings. where they might look at job modifications, again, more of a customized approach to someone returning to work, assistive technology, schedule changes, medical or adaptive equipment that someone might need, ergonomic interventions, and so on. At this point, other job openings may also be explored. If the employee is qualified, they may be placed in that position generally without competition. So again, the strong communication that the employees are valued and that they want to keep them in the workforce. They also conduct periodic satisfaction surveys on their integrated leave department, their leave policies and practices, their return to work programs, their individual vendors, and they provide opportunities for employees to make suggestions for improvements in this support system and integrated leave process that's available to them. Another promising practice that I found intriguing and thought was a wonderful addition is that they do job analyses. Job descriptions are continually reviewed. In many organizations, job descriptions are rarely reviewed. So this really does represent an important practice. Their job analyses happen for every position and include the mental and physical demands of the job, working conditions, essential functions, and also the demands of non-essential functions. So it gives them an ongoing analysis of every position in the organization, which would help them if they do want to customize or make another position available to someone who may acquire a disability or an injury or needs some kind of accommodation. So it allows for the ongoing customization of jobs. Another part of their job analysis is an ergonomic analysis that is conducted as needed, can be requested by the employee, can be requested by a manager to determine the need for modifications or accommodations to address safety, training, or specific job functions. And as noted, training is done on proper posture and safe lifting techniques if that's what a job entails. Ergonomic needs, adjustments in equipment are also considered. And the safety and injury prevention are such a strong focus in this corporation that every location has its own safety committee. So again, a strong communication that employees are valued and that we want to keep you in the workforce. So what are some of the replicable return to work practices that we learned from this corporation? One is the importance of creating and communicating a culture where employees feel valued and essential. And I think we've reviewed, quite a few ways that this corporation was able to do that. They also created an infrastructure that integrates disability management and other services with return to work and stay at work initiatives. So the creation of an infrastructure and the integrating of the different services was a real strength in this organization. They built in income protection, including finding a way to connect short and long-term disability. Businesses can work with their vendors and suppliers to ensure that systems are in place so that employees don't miss a paycheck should delays occur in determining their status or eligibility for workers' compensation or another income replacement program. For example, should there be a delay or indecision about whether a workers' compensation claim is approved, workers' compensation staff in this corporation contact the short-term disability carrier to process a claim and issue a paycheck until the issue of whether or not they're eligible for workers' compensation is resolved. Should the claim be determined compensable, the workers' compensation administrator will reimburse the short-term disability carrier. Therefore, the corporation can create an agreement to provide that kind of seamless income protection. This business practice supports employees, better assures that they will return to work, lessens any hardship from lost or interrupted income for an employee experiencing injury, disability, or illness, lessens the development of adversarial relationships, and decreases the likelihood of unnecessary litigation. The other practice that this corporation does, and again, there's more detail in the report that we'll be posting, is to design long-term disability plans that encourage return to work. Additional replicable practices are to ensure clear, consistent messaging and easy access to information promoting return to work. This corporation trains all of its managers, posts information on internet and intranet for employees to be able to access, provides training and support in managing the return to work process, and that's both for managers and for employees and for the vendors that support the integrated return to work process. So they provide consistent training and support, and they integrate communication between all stakeholders to meet medical, vocational, and financial needs. So to replicate this kind of seamless service delivery brought about by integration and collaboration, employers can forge vendor partnerships, as was the case in this corporation, and encourage communication and collaboration by providing platforms for them to learn about each other's resources, develop business agreements to enhance communication and overcome potential HIPAA noncompliance or issues that people may be concerned about, schedule periodic meetings with opportunities for vendors to communicate and share information with each other and with managers. And some corporations offer this in-house rather than using third-party vendors. Certainly the same thing could happen and probably would be easier if these services were provided in-house. Ensure that vendors or in-house providers have access to current information on available resources from whatever network is available so that they can make referrals, and educate vendors on the organization's culture so that their work supports the corporation's mission, vision, and values as they relate to support for workforce retention and the support for people with disabilities. One of the things that this corporation does is fairly regular satisfaction and feedback surveys, so ensuring that there's regular feedback from customers and employees. Customers probably are less satisfied in organizations where there's a lot of turnover and where employees are not happy, so getting feedback from both is important. Creating prevention programs informed by the return to work strategies, so creating banks of pre-identified job activities, guidance on return to work accommodations, and that kind of information that can be available so that if someone does become injured or acquires a disability or an illness, people don't have to invent things from scratch. Offering injury, illness, and disability management and prevention services on site where possible so that people don't have to miss work. And creating financial incentives for return to work. And this company did incentivize this for managers, so managers that did a very good job of returning people to the workforce who may have been out because of an illness or injury or disability, were rewarded for keeping people in the workforce. So another way to show that that was highly valued. There's a lot of wonderful information out there on workplace flexibility, on retention, and on practices that enable people with disabilities to enter the workforce and stay in the workforce. So we wanted to provide you with some resources that you can tap into afterwards. We mentioned that there's a wonderful workplace flexibility toolkit on the ODEP website that gives more than 100 examples of things that people can do from an employer, an employee, and a policymaker or even researcher standpoint, and that look at the pillars of flexibility. The Employer Alliance has a toolkit. Ken's organization, Families and Work Institute, and the When Work Works website have a toolkit on workplace flexibility. There are a number of websites where, again, you can find very robust information about accommodations, flexible work arrangements, customized employment, and other resources for employers, the Job Accommodation Network, Work Options, the ODEP website again, and the U.S. Business Leadership Network. That the USBLN website actually has, from some of their affiliates, case studies of employers that also have done, just very creative things to be able to recruit, retain, train, and return to work people with disabilities or other people who may be experiencing challenges. And we provided you a link to the study that Ken discussed earlier. There's a lot of wonderful information in the study. I mean, he gave us the short form of some of the highlights of the study, but it really has some terrific information and does contrast it with previous years. So there's some other research that is available that we wanted you to have links to, but we wanted to save time for questions. I know some of you have been posting questions for Ken or for myself. So with that, I will turn it back to Elizabeth. Thank you.
Great. Thank you so much, Rebecca. I hope all of you are enjoying this conversation as much as I am. It drives me to think about the LEAD Center and our 3 areas of work around leadership or policy, employment, and economic advancement, and how many of these strategies really speak to all 3, that the return to work policies really create that environment of employment that's going to preserve the economic advancement of the individual, and how powerful all of that in combination can really be. I wondered if Nakia could do me the pleasure of unmuting Chris Button so we can see if, as you all take a moment to provide any additional questions you have into the chat box, if we see if Chris might have a few words to add to this conversation.
Thank you, Elizabeth. I have very much appreciated and enjoyed, as you have, listening not just to Ken but to Rebecca provide the information on the various pieces of research that you all are doing. Workplace flexibility as a broad topic has been something that ODEP has been involved in and invested in really since the get-go. And the whole idea of these various workplace strategies, workplace flexibility strategies, as being able to be put together in a way that attracts and retains the best workforce for an employer are just really important, and very, very important for people with disabilities, because some of these strategies are really not only the benefit of flexibility, but they, for many people with disabilities, can sometimes make the difference in their ability to contribute to the workplace. So as universal design strategies for employment generally, and as retention and return to work strategies, these are really, really important. So we've really been enjoying listening and look forward to the questions.
Thank you so much, Chris. So Ken and Rebecca, we have quite a few questions for you, and we're going to try to get through them all. If we don't get to your answer today, and please know that we will do our best to get back to you, or if you have a question after today, please feel free to email myself, Elizabeth Jennings, at ejennings@ndi-inc.org, and we'll be sure to get you a response. So Ken, I think the first question goes to you. It speaks to the national survey and asks, you know, this survey is really looking at employers with larger number of employees. Do you have anything around workplace flexibility practices that you can share in regards to small businesses or those that have 20 or less employees?
Unfortunately, the study that we do looks at 50 and larger. Where we do have some information is out of our national study of the changing workforce, where we look at employees, but some of those really, I should describe that more accurately. We generally report on our data on employees, but we also collect information on small business owners as well as independent consultants and contractors, people who don't work for someone else, but don't employ anyone else either. And so we have some of their experience information, and this coming cycle, we will be collecting information on their disability status and their attitudes around the support for people with disabilities in their workplaces. So we'll be able to say a little bit more this coming year when we have that data from that group of people, many of whom are going to have, if I remember our last data collection, 25 or fewer employees. So that's where we get that kind of data, and we'll be looking in more depth at people with disabilities in that data collection.
Thank you so much, Ken. The next question I'm going to direct towards Rebecca, but Ken, please feel free to add in if you have something to add. The next question is, how do return to work programs differ for those who have worker compensation cases compared to those who incur a non-workplace disability?
One of the things that we learned in the study that we did of the corporation that I just presented is that return to work programs don't necessarily have to hinge on where the injury or illness happened. This particular employer didn't differentiate between whether or not it was a work-related or non-work-related issue. That the commitment was to get people that they valued in the workforce back to work. So they made it work. They integrated the support so that if it turned out that someone wasn't going to be eligible for workers' comp, the short-term disability would pick up. If they were eligible for workers' comp, then that would cover the time that they were out from work, but they would still be working with them on a return-to-work plan. And if it was an extended leave that went beyond their workers' comp benefits, then the other benefits would kick in. Workers' comp can be part of a return-to-work program, but it's not. It doesn't have to be a linchpin, and I think because they go out of their way to do outreach and to start return-to-work planning as soon as they can. You know, they really chose to not focus on that. I also, in response to the previous question, you know, some of the resources that we posted do differentiate between small and large employers, but many of these practices are somewhat easier in smaller employers in terms of really individualizing the support that someone might need. Smaller employers may have more trouble with the income replacement pieces of this, but in terms of other things that could help someone gradually come back into the workforce, you know, there really doesn't have to be a difference between the small and large employers. Ken, did you want to respond at all to the other question about workers' comp?
No, I think you've covered it fully.
Thanks. Thank you, Rebecca. So Ken, I think the next question is for you. The individual is pointing to one of the findings that you had around employers now looking more to productivity rather than face time. and they're asking, is that assessment a reference to some flexibility criteria, or how did the study come to determine that as a question? Kind of what's the history of that question?
Absolutely. So to be very clear, we literally asked the respondent what their organization does. So are you encouraging supervisors to assess people by what they accomplish rather than the amount of time they spend working? How strongly do you agree or disagree with that statement? So it is the employer themselves saying that they are engaging in the act of judging an employee by the amount of time they spend working and not by what they accomplish. So it's a surprising statement to see employers saying about themselves. And so that's even though it's a single item, it's one that you would expect to go in the opposite direction. It's just because people want to say positive things about themselves. From the perspective of why we inquire about this, one of the things that we find happens very often, especially in conversations about flexibility, is that managers, either through a lack of training or a culture of the organization, end up often focusing on behaviors that don't actually add value, but that look like they do. So seeing you at your desk means that you are working only in somebody's mind. You could very easily be on Facebook instead of actually doing your job. And so, but it's easier to look at you and say, well, you're here, and therefore I'm going to assume you're working, as opposed to saying, well, let me actually look at your products. Are they high quality? Are they arriving on time? Are they satisfying the client? Am I getting responses to my communications in a timely manner? And when organizations really look at the behaviors that actually add value to their business objectives, they see a much better result than when they look at these sort of proxy constructs like, are you there? It becomes a little bit complicated in organizations that literally bill for time. And so that's a place where flexibility really has a much more significant battle with the question of overwork, where the organization has sort of an incentive to keep your time high, even if you did the job 20 minutes ago. And so that there's the types of organizations that are still really struggling with how to balance the fact of doing your job with how long it takes you to do your job. But generally what's seen is that employers don't benefit from a focus on time, but rather a focus on results.
Excellent. Thank you so much, Ken. So we've had a few questions that relate to employer motivation for some of the return to work strategies that we spoke to from the study of the large corporation. So I'm going to merge a couple of those and direct it to Rebecca, and of course asking Ken to please add your comments. Also, folks at ODEP, you're unmuted, so if at any point you want to respond as well, please feel free. So the individuals asked, was there a motivator for this employer? They seem to have some great strategies. Was there an underlying motivator outside of their view of employees as customers? And then other questions asked, what motivation is there for employers to do this? And does any of the current or recent legislation on disability in workplace provide some teeth to encourage employers to put some of these practices into place?
Thanks, Elizabeth. That's a big question. So the motivation for this employer, and I think what is behind everything is it's all about leadership. You know, that the leadership was committed to supporting the workforce and believed that that was best for the employees and for their business. And I think, you know, most employers would agree that retaining your talent and keeping productivity high and letting employees know that they're valued benefits benefits everyone, but it definitely was the belief of the leadership of the corporation that if you treat employees well, that they'll stay and they'll treat the customers of the business well, and that it just trickles down. And so they, in order to do that, especially as their workforce was aging or as people may have acquired disabilities or illnesses or had injuries, you know, they really saw that it was in their best interest and in the employee's best interest to support them in an integrated way. In terms of the, you know, the teeth that are available, again, you know, there are benefits to employers for doing a good job of having an integrated, diverse workforce that reflects who their customers might be. And you know, I think that the USBLN, you know, not only looks at employing people with disabilities, but making sure that those businesses, you know, have customers who look like their employees, and because the you know, 1 in 5 people in the country have a disability or have a family member with a disability. There certainly is legislation that, you know, people who are federal contractors, organizations that are federal contractors are now compelled to have 7% of their workforce be people with disabilities. There are incentives for veterans and for Vietnam veterans to be in the workforce. So there certainly are those incentives or requirements that that employers, you know, have become aware of. I don't know if ODEP wants to say any more about any of the federal legislation that would provide teeth for employers.
Well, of course, the 503 rules have a strong encouragement to employers, as you implied, to hire people with disabilities. There's a lot of activity here at Department of Labor to pull together information that will be useful to employers and contractors in particular to be able to meet that desired goal. So that's certainly a big and highly relevant area.
Thanks, Chris.
And Ken, do you want to have any final word before we move on to our next webinar coming up in September?
Yes. One thing that you'll see in the report on the information I presented earlier is we actually ask employers what's their motivation for providing work and family assistance programs, much of which is flexibility. And what we have seen is while retaining employees in general is the highest endorsed item, the second one is just to help employees manage work and family life. Mandated by law is only 11% of our respondents saying that that's why they engage in these activities. And so I think there's important recognition that employers don't always do things just because they are forced to. Sometimes, you know, that emotional and positive approach can be as persuasive, if not more persuasive, than saying that they have no choice. So I think that there's a value in both the legal approach and the carrot approach to encouraging employers to engage in these activities.
What a great final word on this topic. Thank you so much, Ken, for being with us today. Thank you to Rebecca, and thank you to our partners at ODEP for making this webinar possible. As you all know, the LEAD Center offers a free webinar series the last Wednesday of each month from 3 to 4:30. We're going to be finishing up our employment webinars in the month of September and hope you'll join us then. The topic will be strategic partnerships that lead to better employment and economic advancement outcomes. It'll be a look at our pilot project that's been going on with Centers for Independent Living, and American Job Centers in 5 different states. And we'll be excited to share with you some of their findings and some of the work that they're doing to continue their partnerships and continue to support the employment and economic advancement of the individuals with disabilities that they both serve. I want to say thank you again to Dr. Matos, Dr. Salone, and to Dr. Button at ODEP. I'm Elizabeth Jennings. Again, if you have any questions beyond today, I hope that you will shoot me an email. And if you're looking for our next webinar or the report to be released and you haven't done so yet, please join our listserv. It's located at www.leadcenter.org. That'll be your best way to get up-to-the-minute information from us. Thank you all so much for joining us today. We look forward to having you on the line next month.